It's great to be here. I was listening to your discussion before, and I think you might have talked a lot about the stuff that I'm going to talk to you already, but we might land in a different place in terms of what it means for a union to actually engage with the public and government. So I want to give you a little bit of context in terms of where we're starting from. We're starting from a position where there's an orange buffoon as the president of the biggest economy in the world. That is the reality that we live in. In these interesting times, we know that experts have been dethroned. People do not believe experts. Be very mindful of what is this landscape that we operate in. We know that politics is changing rapidly, and it's not always changing for the better. You can't control that, but you have to use it for your purposes of getting the right outcome for society. We know within the backdrop of this is health demand that continues to rise and will continue to rise, and we will continue to find unwillingness to pay for it. The biggest challenge is the social contract that defines how and where we spend our money, how we prioritize, and who we help is no longer well defined. We do not connect with every group of society any longer. The pain, the suffering, the poverty is hidden and out of sight. You see it every day, but the rest of society does not. It is very unlikely that simply asking for change, looking for leadership from politicians is going to work. We're going to have to make choices, even though we know what the technical solutions are. Because the reality is that technical solutions will not fit within the envelope that is both in the social, public, and fiscal constraints. You have to decide very strongly and very early what it is that you're influencing. Are you influencing the public, or are you influencing the government? The model of lobbying for the last however many decades has been to convince government of what is the right thing to do. I will tell you that I think that model is broken. It no longer works. If it did, Clinton would be president. So the backdrop is this time is different. Until the GFC, I used to laugh at people who said, this time is different, because it never is different. They're echoes of history. It's different in the sense that the echo of history we find ourselves in today is more like the 1930s and 1940s than what we have experienced in our living memory. Despite how much white hair you may have, you haven't lived through this before. Experts are under attack, and this really matters, because we are not going to see the agenda being set by people who have studied the issues. We're not appealing to reason and policy. We're looking for fixes that are emotional and seem convenient. And that is why politics is shifting, and that is why whatever path we lay in front of us has to be very mindful of these changes. Because I'm an economist, I'll give you some perspective in terms of why I think this time is very different from other times. And we only have to look at the economic recovery from the GFC to see that this time is indeed very different from what we have experienced in the past. In that orange line, there is the economic recovery from the great financial crisis, the global financial crisis, and in the gray shaded areas, every other economic recovery since the 1960s. You have to go back literally to the Great Depression to find another recession that was this steep, this long in the making. We haven't been in this situation in our living memory. And what we find is experts simply do not understand what is happening. I would have put up my own forecasts and predictions, but it's embarrassing, so I didn't. I put up the Reserve Bank's forecast instead, who made exactly the same mistakes. In the dotted line are the Reserve Bank's forecast for interest rates. And don't forget, this is the one job that they have. And the black line is what actually happened. Not once in the last 10 years did they get it right. Experts who have one job didn't get it right. Why would you trust them? It is not just economists, it is across many areas of expert advice that people are losing faith. What we expect of our experts is too much. We have no ability to foresee. What is it, the Yogi Berra quote? Forecasting is difficult, especially when it's about the future. But because experts don't get it, we have to ask, why is it that we're making these mistakes? The reason we're making these mistakes is because what's happening in terms of people's behavior, social behavior, and where we find, following the reforms of the last 30 years, is a society that is very different from what we have experienced in our living memory. None of the correlations, our rules of thumbs that we engage are working. As a result, we have to think very hard about thinking differently about the future and being very mindful that we actually have very little control and there's more uncertainty in terms of how things might unfold over coming years. For me, the watershed moment in terms of this uncertainty and what it means for politics and for regulatory settings was Brexit. And of course, Trump. How many of you in the room expected that Brexit would win? Man, you are a depressing lot, aren't you? How many of you expected Trump? It will be the same people, right? I hoped against hope that Trump wouldn't win. But if you look at the numbers of who voted both to leave the European Union for Brexit and those who voted to leave to elect Trump, there were big commonalities. And the big commonalities were, it was typically people who were uneducated, people who were older, and people who lived in the provinces. In this chart here, you'll see these are the net leavers in orange from Brexit. And it's not surprising that this is happening because it was essentially a vote by the dispossessed. These are people who are angry, who have been left behind, essentially since the reforms, the neoliberal reforms that happened in the US in the 1970s, the Thatcherite reforms in the UK in the 80s, and the Rogernomic reforms in New Zealand in the 1980s as well. But what is interesting for me is not so much that this is happening. We knew this division was there. We knew that this inequality opened up in the 1980s, and we haven't closed it since then. What is really frightening is that the dispossessed are now the majority of voters. And what they're voting for is simply change. They're not voting for something that is better, somebody who has a 400-page policy document. They're looking for somebody who's going to make America great again. Right? No idea how he's going to do it, because how is he going to create jobs in the Rust Belt? But that is what's going to make him popular. At the risk of making predictions, after showing you how I don't know how to make predictions, I fully expect that Winston is going to be very popular at the next election. Winston and I only have two things in common. We're both brown and handsome. But beyond that, I think he is going to offer what people want to hear. They will want to hear that we're going to go back to the good times we had in the 60s. Any of you who remember the 60s, it wasn't that great. Certainly in terms of my studying of history, I wasn't alive back then, but in my study of history, it wasn't that great. But Winston is going to say, look, we're going to be excluding migrants, we're going to be closing up the borders, we're going to get back to where we were, life is going to be much better. He's not going to tell them how he's going to do it. He's just going to tell them he's going to do it. And this is the shift in politics that we're dealing with. It is an era that is free of facts, free of policy, and full of rhetoric and emotion. And you have to be very mindful that in this environment, we have to be able to navigate these invested waters, to be able to get our messages across and to create the change in public perception that we all desire. In terms of health, I'm sure you guys know this very well, but I want to just go through it because I think it's really important to understand the scale of need and the urgency of action that we face. We know that demand is rising and it will rise significantly over coming decades, and we're going to have to make important choices because regardless of how we look at it, there will always be constraints in the system. The first thing that's going to drive up a huge amount of demand is there's just more of us and there are more old people. Right? How many of you in this room are under 40? I think some of the hands raised were a bit optimistic, but I should have put my hand up to increase your numbers. New Zealand is officially aging just like every other country in the world, right? I mean, none of this is new to any of us. We knew this was coming. But this is not an issue of the future. It's happening right now. So this is the year that we're going to get the crossover of over 65s outstripping under 15. So we're never going to get younger from here. It doesn't matter how much immigration we have, how much population growth we have. We're simply going to get older. As a result of that, we are going to need more health services than we've ever needed before, both because the population is growing and both because the composition of the population is getting older. But we also know that part of the reason why the population is growing so much older is we're living a hell of a lot longer. Now, I love this chart because this, I think, really puts in context the massive progress that we have made with public health in terms of sanitation, water quality, vaccination, our medical system, all of those bits and pieces. And if you look at, 1900, the typical female could expect to live to 60 years, and now we're looking at closer to 85 years. This is huge progress that we've made in the context of in human history in a very short period of time. And this is the big reason why we've got an aging population that is growing so much. Not only because we had the baby boomers, that's only a very small part. The biggest reason why we have such a large growing older population is because we are living longer. We should celebrate that, but we also know that old people consume a significant amount of health services, and that's going to drive up demand. And you guys have a very big moral dilemma, moral issue that you have to grapple with. This is the stuff that Atul Gawande talks about in terms of end-of-life care. How much of it is about extending life versus extending death? These are big issues that you have to grapple with, which you already grapple with, and something that I think has to happen outside of politics. We certainly don't want politicians involved in issues of ethics. The other thing that is really quite frightening is the sickness and the almost epidemic proportions we find ourselves in, particularly in certain socioeconomic groups, of people getting much sicker. This is data from the OECD, I think for 2013, and in the OECD, New Zealand is only behind the US in terms of being the second fattest nation in the world. Great. What an accolade to have. And those of you who work in public health and those of you who work in hospitals, I mean, as all of you do, you will see these people. And the reality is we've got a proportion of our population that is extraordinarily sick. And quite often it is combined with poor housing, combined with poverty, combined with a whole bunch of other issues. So we're really talking about a story of New Zealand's health outcomes that is very different depending on where you live, what your socioeconomic background is, sometimes what your ethnicity is, and all of those kinds of things. And while there is some absolutely good news in terms of our general population getting much healthier overall, we're living longer, we also know there are very many people in New Zealand who are getting too fat to be healthy, and that we are facing some serious issues in terms of the health complications that will come as a result of it. We know that as a result of aging, we're going to see significant increases in health expenditure. And this is some data from the Treasury on public health expenditure by age group. And we know this really well. This is not just true for New Zealand, but it is true for practically every country, that most of the spending, in fact, happens at the end of life. It's very expensive business dying. The thing is, we have to decide where is the line that we have to draw between the fiscal and economics of looking after people and the ethical dilemma of whether or not those interventions that we provide are actually improving the quality of life. And I don't know what the solution is here, but what we do know is that with an aging population and people living much longer, we're not going to see this pressure going away anytime soon. The backdrop of this is we've got fewer people paying taxes to fund our health system. How long do I want to pay for old people to die? This is the question that young people will have to grapple with over coming decades. And these are projections, they are projections, they're as good as any kind of projections and forecasts, but if you put it in the sweep of history, we know what sort of trajectory we will see in terms of health demand. It's curious, if you look at our health spending pre the 1930s, it was very, very flat relative to GDP, and that's not surprising because we didn't have a public health system that really looked after people. It was only when we built the social welfare state that we wanted to and could and chose to look after our people and spend more money on health. And it has increased over time. You can probably observe the changes in governments over time as well. And it's not surprising which end might be doing what. But we also know the political reality of what we find ourselves today is that the left is in a disarray, that the left is struggling for purpose, is struggling at the polls. The same is true in New Zealand as it is true in the UK, as it is in the US. This is a global phenomenon. You have to understand that what we're seeing here is what is the kind of demand that will underpin it, but not necessarily what money will in fact be allocated to spend on health and welfare and all those other bits and pieces. We know for a certainty that there are already massive amounts of rationing that happens in the system. There are people who miss out, and the level of care provided is probably not as high as you'd like to. And we know that we have to make even harder choices going forward because the rationing is going to get even more intense because the tax take is not going to rise as fast as the demand in the social contract that we have in place today. And this means we're going to have to make some very hard choices of what is going to be delivered, what is not going to be delivered, and who is it that's going to miss out. We know that the rich and the famous will be very well looked after. You only have to be a homeowner in New Zealand to be rich and famous, I guess. Judging by Auckland streets, everybody drives an European car. You do that when your house price is $1 million and your mortgage is $1 million. What we see in terms of private spending is it's actually very small relative to public spending, but it has been rising over time. And we will expect this trend to rise. But what it's telling us is that those people who have the means are finding some way to circumvent the rationing and the pressures that we see in the public system to be able to access health care, particularly elective surgery and those kinds of things outside of the public system. It has to rise because we're not going to see the resourcing of the public sector to be able to meet the needs for everybody. But we know that what this will do is create a massive amount of impact on the inequalities that already exist today. If you look at where private spending of health is, unsurprisingly, most of it is spent by rich old folk because they need it and they can afford it. Every other group spends far less, and particularly if you're poor or a beneficiary, you have to rely on the public system, and they're going to be joining the end of a lengthening queue over time. New Zealand is increasingly becoming a country for rich folk, and it's getting harder and harder to be poor. The social safety net, the social contract that was meant to look after everybody regardless of background, regardless of position in life, is a promise that is broken and has been broken for some time. The other bit that is going to happen, and we don't talk about this enough, is the massive inequalities of service provision, of capacity that we're going to see in different parts of New Zealand. And those of you who are from outside of the main centres will know this already because we've been facing these pressures for quite some time. But when we look at what's happening in terms of our population in the provinces, what we find is it's getting lonelier. It's getting mainly older people living in ones and twos, and most of the growth in households across New Zealand is in 1- and 2-person households. In places like Gisborne, there are more bedrooms than people in that region. People are rattling around in big houses because young people have left, their partners may have died, whatever has happened. We're looking at a situation where essentially communities are hollowing out, and we have to ask, what is the level of service we can provide in these communities? What is the quality of healthcare we can provide in these communities? This new added dimension of inequality of healthcare across our regions is something that is going to become more intense over time. On the right-hand panel is a chart of where the population is going backwards in the last census in 2013. All the red splotches are districts that are going backwards. And you'll see that there are many, many districts, particularly in the North Island, that are going backwards, and it is only going to intensify over coming years. And we know that as the population shrinks and gets smaller, it gets harder to provide large-scale services. The economies of scale are simply not there to be able to make it economical. So what happens? Do we suddenly say that if you live in this community, you can no longer access the same level of healthcare that you could 30 kilometers away or 100 kilometers away? Where do we draw the line in terms of what is reasonable and what is not reasonable? We know that it's going to become, there are many places that are going to become very lonely places for people to live in, and they're going to be too inefficient to service. When you've got language of efficiency in your government, it is very unlikely that we're going to be pouring money into regions where population is going backwards and where there is no prospect of population gain. We're going to hasten the decline of many of these places, but we're likely to find these traps where people are aging and cannot access a basic level of care that I think every New Zealander deserves. So we're stuck in this really strange environment where we know that demand is rising, but at the same time, we're likely to see the provision of servicing actually fall away in places where the local conditions are very, very different from the headlines that we see. In terms of the big picture of health demand, for me, it's very much around, it is going to grow massively, and most of it is going to be an unmet need because there is no desire and there is no funding that is currently allocated to meet that need. The public sector simply cannot cope unless there is a huge amount of more resources that are applied, and that means we've got to spend a hell of a lot more money on it. The reality is the tax base is being eroded by an aging population, and there is no government around that wants to spend more money. We're stuck in a very awkward situation. We have to make some choices that are ethical on aging, on when we provide care, what sort of intervention, and at what cost. But more importantly, the choices we have to make, I think, are on fiscal and around the social contract. One of the great tragedies of New Zealand is that post the construction of the welfare state in the wake of the Great Depression and the wars, we have lost that conversation. Does New Zealand actually understand what the social contract is? I would argue, no, we don't. I don't know what New Zealand stands for anymore. We live in our little sorted societies where we look at people who are like us, who are comfortable like us or uncomfortable like us, but we're separated from each other by where we live, what kind of professions we have, and all of those things. And in this society, it's very difficult to have a social contract where it has enough empathy to say that I'm going to give something up for those people down the road that I never see to look after them. And I think you're going to find that is the biggest struggle in terms of convincing people about what kind of solutions we have to put in place. For it doesn't matter what problem we're talking about that we see in society today, whether it's housing, whether it's social policies around welfare, around health, around justice. We know that one of the big things that underpins that is inequality in income, in life prospects and wealth. And there is no way to change that until we change our outlook in terms of what is it that is important and find some empathy and love in the way that we discuss policy and discuss redistribution. This is probably one of my favorite charts or one of my favorite illustrations because this is essentially what politicians grapple with every single day. You're all doctors, you're good at reading charts, so I'll give you a few seconds to have a look at it. But essentially, it's the tension between how many votes you'll get from a policy and the benefits the policy will actually have, and they're not necessarily the same things. I think a lot of the policies that we currently see being made are in the top left-hand corner, which will get you many votes but not actually do much good. They're called Daily Mail appeasement. I guess in New Zealand's case, it's Stuff or Herald. They're all much the same. On the very bottom right-hand side is the really good stuff, right? It's not going to necessarily win you votes, but they will actually work. Those are the kinds of things you guys talk about a lot. And that's why it's hard. It's hard to get the breakthrough into the public sphere if it's not going to get the votes. What we're all looking for is the stuff that's in that pink bed, the unicorn zone, that is both a vote earner and it's going to be good policy. There are not many of those. There really aren't. Somehow we have to find ourselves in that real politic area where we're trying to give governments, whoever that might be, some choices, some options, some policy issues that will both win them votes and will actually do some good for society and for the sector as a whole. We live today in a world of poll-driven politics. You will not be able to pursue unicorn policies because they're too hard. Nobody reads policy documents. What's missing in all of this, in our engagement with the issues and the solutions, is not that we don't know what to do, it's that we have missed the public in public policy. The biggest, the most challenging issue that your industry and every other industry that touches the social side of New Zealand faces is how do we overcome the barriers that we see in New Zealand today in terms of the separation between the rich and the poor and the inequalities that we see. How do we get through that, mend that gap, and tell a story that is good for everybody? It is really quite difficult. The reason why I worry and the reason why I despair is because the kind of politics that is developing in the US, UK, and is likely to come here is a politics that's based on polarization rather than finding consensus and middle ground. And that is the big break that we see from the last 50 or 60 years, where by and large, political parties had some common ground. Yet, we now find ourselves at the consequence of the inequalities that opened up in the 1980s, that have not closed for 30 years, and these people are angry, separated, and disillusioned. But more so, not only are they dispossessed of hopes and dreams, they're actually different people from those who consider themselves successful. The winners and losers are so different from each other that there are different brands of politics for those two different groups. When you're shouting at each other to find solutions, the reality is that a lot of it is going to be a get-them type politics rather than find that common ground. I think what we have to find is a way forward where we can find that message, that conviction that there are policy choices out there that can appeal both to the pollsters, both to the politicians, and to the actual outcomes that we're all looking for. To me, the biggest challenge that you face is that nobody has really cracked how to do this yet. This is the biggest challenge that you face. The conversations you should have following this is around finding that gold dust, or at least the real politic, to be able to find some offering that you give to the politicians and to the public that is palatable and implementable. Because otherwise, we'll be spinning our wheels and doing the same thing that we've been talking about for the last 30 years and go nowhere. If you cannot get health on the ticket for the next election, you have failed. So I'll end where I started. I think we're living in probably the most interesting times, whether it's in terms of economics, politics, or public policy. The experts have been resoundingly rejected. We have to find a way back into the conversation. The politics is changing very rapidly, and we have to make a really strong mark to find our place and to make sure that we convince people of the value and the solutions and options that we can provide. We know that for you guys, you're starting from a position of incredible increase in demand. The pressures that you face in the system today are only going to intensify over coming decades. In the backdrop of this is the social contract that has crumbled. That means that it's much harder for us to have the conversations that we need to have. Even though we know what solutions are in front of us that would actually work in terms of what sort of resources and practices we might implement, the unfortunate reality is that we're going to have to make choices. You will not be able to do all of those. There will be no government, regardless of color, who will give you the unlimited amount of funds to be able to do that. The only way we're going to be able to make this change in this world of politics that we find ourselves in is to influence the public. We've got to move the polls. The reality is that it doesn't matter how many backroom conversations you have with the minister. Nothing's going to happen unless there is a public demand for change. My challenge to you is, come the next election, put health at the top of the ticket. Thank you.